Welcome to the TokenMarket.net podcast. I am your host, Gavin Knight. Thank you for tuning in. Check out our site for digital asset research, a calendar of upcoming events, and many future upcoming releases. Our podcast features team members of projects in the cryptocurrency space to help shed light on their developments. Just because a project is on our podcast doesn't mean we recommend investment, so always research and engage wisely. I'm here with Krista McFarland from Patientory. They're having an upcoming ICO. So why don't you tell us how you got started in the blockchain technology?
Yes, definitely. I really got started in blockchain through the company inception, Patientory. We had this idea that we wanted to make medical data not only accessible to patients, but to have the actual patient own their information. And I had been following Bitcoin, for over the past couple of years, and the idea just really occurred to me. Why not have patient information stored on blockchain, which was, the power in this Bitcoin technology. And it was really a new source for protecting critical infrastructure. And, just seeing that connection was really how I started to just not only dig deeper in research into blockchain, but make that leap to applying it to patient records.
Have you worked in healthcare? Like, what's your experience with healthcare? Why did you choose that as an application for blockchain?
Yeah, so my domain experience is in healthcare. I've been in healthcare for over 10 years, since I can remember. As a little girl, I dreamed of being a doctor, and I started with research out at the Albert Einstein College of Medicine in New York City. Also did research for the USDA, and then I really wanted to be in business at that time as well. So I worked with hospitals and developing their outreach programs for their clinical initiatives. Then ended up going to business school and consulted for healthcare IT organizations. One of them was an actual EMR implementation software development company. And that's really how I got firsthand, look into EMRs and how they work in sourcing patient data.
So I don't know what an EMR is. Can you tell me? Just for everyone else too. It
Yeah.
sounds like.
So an EMR stands for electronic medical record. They rose up, in the latter part of 2000s, where, especially when our government implemented, the law that said all clinics and hospital had to, start storing their patient information in these electronic medical record software solutions. And we see vendors now, the big vendors out there are like Epic, Cerner, Allscripts, and Meditech, and they store medical data that the doctor uses to treat patients. And they also involve, a lot of them do the billing and the appointment setting for their patients. But over the past 10 years, as where 95% of hospitals have adopted an EMR system, we've seen a rise in cybercrime, where hackers breach these software vendor software solutions to get a hold of patient information and sell it on the black market.
So what's the advantage? I guess obviously one thing is security. You can do some security with the blockchain. What are the advantages that you would kind of sell to one of these providers using blockchain? I assume one of these things is if a lot of companies work on the same framework or protocol, then they can kind of all agree that that's how they're going to store stuff and intercommunicate well. But what are the big advantages you think that Patientory brings to this current model that they have now, EMR?
Definitely. So we're really solving three main issues in our healthcare infrastructure now, and you alluded to one of them, which is the cybersecurity. So we're securing we're securing and protecting the critical infrastructure of hospitals, which are their electronic medical record system using the blockchain, and we're also given access to different systems that work on different vendors, access to patient data. So in healthcare, that process is called interoperability. So especially within the chronically ill community, let's say one patient goes to their primary care physician in hospital A, and they see a specialist in hospital B. They're on two different EMR systems that don't talk to each other. So there's a disconnect in the medical information that both providers need to treat the patient, which attributes to a lot of waste in our current healthcare system, from duplication of tasks, which also hikes up prices in overall care for a patient. So we're able to house that patient information from different electronic medical records and make it accessible to
Yeah, I
different
know
doctors and different patients.
some people who are very ill have to go to the ER frequently, or maybe once every few months, and they don't get a choice because they don't know when they'll be sick. And there's things like medication interactions and what they're allergic to. And I assume some people, they'll be so out of it that they can't even communicate really. So getting that, like that ER type stuff would be really good, because if someone comes in and they've had a stroke or something and they're allergic to a medication that could kill them, that it's possible. Is it possible that this isn't communicated to the other ER?
Yes, currently it's not exactly. So and a lot of this too happens now where, we see mortality because, the doctor didn't have the patient information at hand in time to treat them.
Right, right. So, I've had to deal with insurance companies and such for getting various things, dental bills, and it's a nightmare. And so, how do you actually get these people on board? And I noticed on your site you have a few companies that are backing you. How are you able to get them to get behind this, and how much does that mean, you having those connections and starting to get the ball rolling?
Yeah, yeah. Well, definitely it's the timing now. We see at our current state in our country regarding healthcare, the push for value-based care treatment. And that means, the way insurers are reimbursing doctors nowadays, they're shifting it from an actual volume-based system to the outcomes of their patient population. So that's the third problem we address. So on this new reimbursement model, providers are going to have to show that their patients are improving in care, and we do that through the through the user interface of the platform, being able to, connect with your patients when they're not in the hospital, and also gain access to their caregivers. That's one of the big things we address on our patient platform. So we see these large hospitals starting to look for, digital health startups and solutions to help bridge this transition. So, which is why Kaiser, we were one of the first companies they invested in through the Boomtown Accelerator in Colorado, because they saw the need for solutions like Patientory to help drive the industry to a value-based care ecosystem.
I guess fortunately or unfortunately, it comes down to money. Our healthcare system is very dependent on that. So if there's an economic motive that these solutions may actually improve their bottom line and make them more money, it could circle back to the patients as well. So I know, like I said, dealing with insurance companies, it is all about money and cutting costs and trying to find ways to do that. Now we've moved to sort of a preventative care model. So it sounds like if there's an economic incentive behind it, companies are really going to to jump on it. So do you think that's one of the biggest reasons that they're jumping in now is this new model? They can improve their profits just by providing, better care through communication.
Yeah, so definitely, one aspect of it too. And our overall goal is to, decrease the cost of caring for a patient by a factor of a million. So there are 12 moonshots that was released through the White House for healthcare solutions, and one of that is driving down the cost to actually treat a patient. And in order to do that, you need, technology is the foundation for that, and being able to not only decrease the cost, but the time, spent in seeing a patient, especially with the shortage of medical professions in our country. So with technology, we're able to leverage that to not only, improve the bottom line for a lot of these major healthcare companies, but in tandem see the overall improvement and quality of life in the patient population.
Yeah, and I, talking about cybercrime, one of the biggest things actually is ransomware. So why don't you talk about the ICO? How did you get to the idea of an ICO? I know it's a blockchain project, but why did you decide to do an ICO rather than maybe just traditional round? And how does that fit into like the overall fundraising, taking money from some of these larger entities like Kaiser and other hospitals?
Yeah, definitely. So we're actually doing an ICO along with an equity raise, but we really decided to go with an ICO and opening that up because of the value of the company. So we're empowering patients to, take control of their health in their own hands, and we see the future as this decentralized, tokenized economy, and we wanted to be able to, open that opportunity to the people that we would be serving, which are individuals, and everyone is a patient. Um, and through that model, like the tokens, the Patientory tokens, which is now, traded as PTOY, they're really the fuel for the platform, and being able to access and store data as well as run smart contracts when it comes to, the revenue cycle portion and payments. So we definitely needed a token structure in that sense, which is why we wanted to go the ICO route.
So me as a patient, I would have sort of like an identifier, some way that they can look me up in the system, I suppose. So if I walk into any hospital that uses Patientory, they'd be able to pull up and see that I got X, a CAT scan or whatever done, and these are the results. So basically, for the patient themselves, they have almost like a digital medical card that they can go and take anywhere, and if it's accepted. Blockchain has been difficult to get accepted by larger industries, and obviously medical is one of the biggest in the country. Um, how are you able to get it up to compliance standards like HIPAA and some of the other ones? It's so that it can be used in a way that's acceptable to their protocol.
Yeah, definitely. So, when we picked blockchain as a technology, it actually made it easier because of the way it's structured to actually follow HIPAA compliance, which is a series of rules that a health entity that, stores or treats, stores, or encrypts private health information. And there are four rules that's basically dissected via HIPAA, which is a privacy rule, a security rule, an enforcement rule, and a breach rule. And we're able to, within our business model, protect our customers against HIPAA and any liabilities that may ensue because of our technology.
Right. So it sounds kind of like, if you build a solution that you have to implement at each hospital, it becomes more difficult because the hospitals themselves probably house the software and you have to continue to do audits and have staff, like IT staff and other people on staff just to be able to make sure that the system's running correctly. With this blockchain solution, it's kind of more of a turnkey solution where hospitals can work with it without maintaining it locally. So my question is, how will people actually interact with it? Like the blockchain itself at the low level is very complex and difficult, and how will doctors be able to really easily get this information into their systems and read it and display it? Will there be like a front end or some way for it to fit into existing systems? Like maybe there are existing medical appliances or computers and such that they use specifically for this. Will the data be able to be fed in quite easily without them having to buy new software or computers?
Yeah, definitely. So our software, we're a SaaS service and we seamlessly fit into their workflow. So we have APIs that are HL7 FHIR compliant, which are the standards for transmitting health information from one location to the next. So with data aggregation, the Patientory platform has a provider interface where they're able to manage their patient population and garner that information for facilitated treatment diagnosis. So apart from the APIs that collect the data, we have algorithms for artificial intelligence and machine learning that actually helps the doctor to recommend care plans and diagnosis for the patients that they see. So in a sense, we're also reducing the time that they, spend treating a patient, but at the same time, they're also able to manage their patients on a dashboard.
So you can actually take advantage of having lots of patients and seeing how they've been treated and then evaluate that and say, okay, well, and this is new ground for me, but so this person came in with X condition and we gave them X treatment and, it's a high percentage chance that they do better based on that. So we're able to learn from the data and figure out better ways to treat certain ailments. Is that kind of what you're saying with the machine learning?
Exactly. With the data that's stored for each patient. Exactly.
So the medical provider would get a suggestion saying, hey, other patients with these same symptoms and such responded well with this. So how do you avoid legal issues in that case? If you're giving suggestions and you're sort of playing the role of what sort of a doctor would do to decide, how does Patientory avoid being in a position where they make, say, the wrong suggestion?
Yeah. So I mean, we are going through FDA approval. So this technology, will have FDA approval, but also it's also in our liability clause where the final diagnosis is made on behalf of the provider. So this is something that they can customize for all their patients, but it's also a learning tool that they can use to help them in those decision-making processes.
So it's sort of a helping hand. So is it possible for a healthcare provider to just simply use a subset of the data? So let's say they don't use Patientory for their entire hospital system, but they want to have access to some of these treatment plans and how it's helped other people. Is that possible, or is it individual to the hospital?
Yeah, so we're really, with the machine patient provider education aspect, they're able to go in and see these templates that we've created by diagnosis, so by disease states and conditions, and they're able to basically, it's all unidentifiable information, but they're able to see case studies on different treatment recommendations.
And obviously, healthcare is international or global. So would it be possible for Patientory at some stage to say, test in Canada or test in Europe or test places if it becomes a quick solution? And I think it might also be interesting for people that are traveling because I have no clue how that works. So if I travel to Canada or I travel to France or something, will they even know who I am, right? So do you guys like long term have an idea of this might be something that could tie things together globally?
Yeah, definitely. We're already looking into international markets, especially in the UK, and countries like Poland and Switzerland. So the actual first blockchain secured medical record is in Estonia. So they're the first country to actually have all their citizens on a blockchain medical record. And we definitely see the opportunity to expand outside of the US. The opportunity is there because it's less regulated. As seen in the U.S. healthcare system.
So in terms of competition, which isn't everything, but It seems like you're the first to sort of make some deeper connections in the healthcare industry. I know there's different movements to do generalized records. Factum does a lot of generalized records, but you're really working with one industry. Do you feel like you have sort of first mover advantage and some good connections there that are going to make it easier? And also your focus on healthcare, understanding HIPAA and FDA and such will make it possible for Patientory to really achieve the goals that you set out?
Yes, definitely. It's definitely been easier as a first mover advantage. Similar to the EMR, the rise of the EMR 15 years ago, the ones that lasted today are the ones that were able to, make those quick connections with the larger hospital systems and really plant themselves as the go-to technology.
So, what type of blockchain are you using? Is it Ethereum, or how did you come to that decision? And how does that fit into standards? Did you have to make any tough decisions on what technology you're going to use in order to fit into the existing model and achieve your vision?
Definitely. So we were considering, public blockchain, actually creating our own blockchain technology, considering Ethereum, and we ended up going with a private permission Ethereum blockchain because of how heavily regulated the healthcare industry is, and Ethereum is very established in for use cases and using smart contracts down the line. They were well positioned to handle the current landscape of the healthcare industry.
So I assume you're going to have to heavily audit and really, work closely with technologists and programmers and such. How will you have the pipeline of adding new features secure enough? I know there's always that worry of, oh, is this smart contract going to do exactly what it's supposed to do? So I assume, you're kind of starting with the basic features, but as you add more, how do you plan to, completely audit and make sure that they are up to the par of what healthcare needs?
Definitely, definitely. Which is another reason why we decided to work with Ethereum, so to actually work with them and their team on development, so that we're always up to date on the releases, and while staying compliant with healthcare legal regulations.
Yeah, I know with a public blockchain, and I am like a pro decentralization person, but I know in some industries you have to fit to their model. With the permission chain, if there was an issue, you could roll back very quickly, or you could stop something, or you could put something in place. So that gives you the option to say the different providers that are opted into the network and running the code can put a stop if there's some issue, right?
Correct. Yeah, so it's really the ability on that, private blockchain to, we want it to be decentralized, which is entirely where we're creating a decentralized system of medical information, but at the same time, it's one that is regulated and meets those compliance of the industry.
So you mentioned an equity raise, and there's also an ICO. So why don't you let us know a little bit about when the ICO is starting and how people can get in touch if they're interested in sort of getting to know the project early.
So we are launching our token sale on May 31st. It runs until June 20th. You can definitely reach out to myself and my team via email, info@patientory.com. We're also on Slack and Telegram /Patientory. You can find that information also on our Twitter, twitter.com/Patientory for more updates.
Cool. And there's an email form on your site so people can contact there as well. And are you looking for any developers or people to get interested and excited in the project here?
Yes, we're always looking for talented individuals that want to come and join our family and transform healthcare. So we're always open to meeting new people and just learning.
Well, I'm excited to see where Patientory goes. Patientory. If you guys are able to help some people and save some lives, then it might give me some check boxes if there's a potential afterlife. I don't know how that works, but it'll be exciting to see the impact this has, and if it can actually improve patient care. It sounds like a win-win for everyone in that case. So I thank you for your contributions so far, and I hope that this works out, and we can look back and say, hey, we did something cool, or at least you did something cool with this project. So thanks for your time.
Thank you.